Hello, how are you? How was your week? Did you do anything for yourself? Did put in the comments. I hope you did something for yourself this week. Um, so put in the comments. Let me know what you did for yourself this week. Did you have fun? Hopefully you weren't too busy at work. All right. Though granted, I always think, I say that, but I always think it's a good thing, like when you're busy in a sense of, okay, at least people are taking care of their animals and getting the appropriate or what's appropriate for them to help them feel better. And then at the same time, too, like I hope that, but I also don't want to be too busy. I always hate that the animals have to come in, but it's always nice that they have a place to go. My husband's so funny. Every time, like when he meets people, and when people ask him what he does, he says he's an emergency, or he's a vet. No, he says he's a veterinarian. And then they're like, oh, well, hopefully we'll come see you. And he's like, no, you don't want to come see me. It's like, and they don't, he's like, I'm an emergency veterinarian. I'm the one that you want to be there when you don't need me. Or when you don't want to be there. Not necessarily need him, but want to be there. When you do need him, you want him to be there. So yes, it's always, always tell people, even when they ask me, I tell them my husband's an emergency veterinarian. Just go ahead and get it off the thing there, because he's there when you want him, when you need him to be there, but not when you really want to be there. But I think he's great, but I think all of you guys are great as well. So anyways, today we're going to talk about preventing and working through burnout with Reiki. Now, I know that may sound a little new agey and out there for some of you. It just, all I ask is hear me out, because it's very interesting. There's really interesting facts in there that I was, even when I was working through this or looking through it, I found very interesting with some studies. So again, like I said, a lot of this I know works from many years of research, from my experience with my nonprofit and researching through there. I've done some of this with my husband to help him work through his burnouts and prevent burnouts. No, he hasn't done Reiki. I will tell you that much. But other things he has tried, it has helped. It does help. So I go through and I narrow these things down specifically for burnout in the veterinary community and how it helps with burnout. So when I research these to find studies, because I know a lot of you think in a scientific scientific way and want studies and facts with it. So that's what I do. And when I before I do these shows, look that up so I can give you that information and those studies with it. But yeah, so all I ask is hear me out. I will say there are some interesting facts in here that I even found interesting myself when I was doing that to prepare for today. So I'm going to first talk about what Reiki is, the concept behind Reiki. Then we'll get into the benefits, okay? So I want you to kind of understand it. Bear with me. So Reiki is a form of energy healing. It is an alternative medicine practice centered on the belief that a vital life force or universal energy flows through the body, and imbalances in this energy can lead to illness. Practitioners aim to restore this balance and help by channeling energy through their hands or other means. So when it says it's a form of energy healing, when you say energy healing, it's like it also includes massage therapy, like acupuncture and acupressure and Reiki. All of those are forms of energy healing, as well as like even meditation. So when you go on a little bit more spiritual level with it as well. So anyways, so how does it work? So in theory, Reiki is, so you have life force energy. And so everything's made up of an energy. The foundational idea is that a vital life force exists in and around the body. Then you have energy blockage. So negative experiences or other factors create blockages or disruptions in this energy flow, potentially leading to discomfort, pain, or disease. And then you have restoring balance, which the energy healing aims to clear these blockages and restore the normal balance of energy flow, activates the body's natural self-healing response. So the whole ingest, your body, energy, you have energy all around your body, outside of your body. And what it's saying is it flows through your body. Then if you experience something negative, so even something like in your childhood or that affected you and you thought you worked through it, but really you just only suppressed it because you had this little thing called a subconscious mind. So you suppressed it versus working through it. And then what it's done with your energy is kind of build up like a knot. So kind of like a muscle knot or like a blood clot, if you want to get medical about it. So your energy has that same thing, though granted it's nothing you can physically see or feel, right? And so your energy, and with that, it can cause like illnesses, it could cause pain or whatnot. And then the concept of Reiki is it works, somebody else uses your energy and works through that and gets that flowing again. So that's the whole general concept with Reiki, with the whole energy. Reiki is a Japanese technique where practitioners channel universal life force energy through hand positions, often held lightly on or above your body. What are the benefits? Stress and relaxation. It promotes deep relaxation, which can help to calm the nervous system and lower cortisol levels associated with chronic stress. Research suggests it can reduce work-related stress and symptoms of burnout, especially for high-risk groups like mental health clinicians, beyond placebo effect. You all fall in this category. Veterinary medicine falls in this category. As an ER medical professional, ER has the highest or one of the highest burnout rates. Proven fact. What's even more interesting is more research is needed to understand its effects on normal stress levels. So this is what I found very interesting. This helps with high-risk groups with stress, chronic stress, high-risk groups for burnout. Studies have proven that it helps with those groups. They need more studies to show with normal stress levels. So very interesting. I didn't realize this until I started doing this research. So definitely something to keep in mind. All right. It also helps with energy restoration by clearing blockages in the body's energy pathways. It helps combat fatigue and lethargy, leaving you feeling revitalized and more motivated. It also helps with emotional well-being. It helps releases suppressed emotions, promoting a sense of inner peace and aiding in the recovery from emotional exhaustion. This is also important. What you do, you suppress emotions. When you're going from case to case, one case could be something, I don't want to say simple, but something that is an easy fix of, here, I can send you home with some Flavonox, or here, I can give you this injection, and the animal's fine. You walk into another room, the animal's a critical case, you have to euthanize that animal. You walk into another room, it's constant, and you're going from room to room to room. Now, this is both GP and emergency, same thing. The only difference is in emergency, emergency could have a hit by car animal come in. Emergency is going to have your more traumatic cases come in, and they're back to back to back. You could have 3 cases walk in at one time that are very critical, and you have to deal with it. You have to suppress your emotions. You have to handle that first and deal with yourself later. That is a lot. It's a lot for GP. It's a lot for ER. Specialty, especially in the cases where you're consistently seeing a patient on a regular basis as a specialist. Watching an improvement is always is great. That makes your day. But if they're not improving, that's hard, because you've built a relationship with this patient. So you're suppressing emotions constantly to be able to get through it. And and a lot of times you don't deal with them. Again, remember what I was talking earlier, you've suppressed, even with things that's happened, you suppressed it. But your subconscious mind is still manifesting it, or still working through it. And so you need something to be able to help you work through and relieve those suppressed emotions. Balancing the body is the core principle of Reiki, is to restore the balance to the body's energetic system, which is crucial for recovering from burnout. So those are the benefits. Let's talk about what happens during a Reiki session, because it's different. A lot of people, it's out there for some people. So during a session, a practitioner places their hands slightly on or above your body. The goal is to facilitate the body's natural healing response and encourage the flow of energy. This session is completely non-invasive and requires no tissue manipulation. Now, granted, I'm one of these people, I would say it's non-invasive medically would be more of what I would personally say, because to me, when you're messing with someone's energy or their mood or even getting in their personal space, that can be invasive to someone, period. So, of course, obviously you're giving them permission if you're going into a session, but that's just my side note. You can, when doing the session, you can remain seated in a chair, or you can lie down, but you're fully clothed both ways. All right. A session may be between 20 and 60 minutes. And then sometimes some patients feel a tingling sensation or warmth, while others may feel nothing at all. So let me explain this. If you don't feel anything, that doesn't mean it's not working. If you feel something, like that's normal. It's okay. What that means is some people are a little bit more sensitive to energy. So have you ever been with someone, or even you yourself, you've walked into a room and it just didn't feel right? Or it felt, you felt very comfortable, or you just felt very like not cold, not physically cold, but just like there's something about this space. That's energy. Okay. So again, some people are a little more sensitive to it than other people are. And if you're not, there's nothing wrong with that. It's just something you haven't opened yourself up to, and that's okay. There's nothing wrong with that. The tingling sensation, what it does feel like is, if you sat on your foot and it's fell asleep, or your hand or something, and you're trying to, you get up and you're trying to get it worked through and stop the tingling, that's the tingling you feel during Reiki, typically. It tickles. It tickled me. I've had one Reiki session, and I felt it because I am sensitive to energy, and it was ticklish to me. I could feel, she wasn't even touching me, but I could literally feel everything she was doing. It was very ticklish. But anyways, so yeah, again, like I said, it doesn't mean that it's not working if you don't feel it. If there's nothing wrong with you if you do or if you don't feel it. Like it's okay. It's okay. Now, where can you go for Reiki? Some yoga studios offer it. Actually, that was where I ended up doing my Reiki session. I was working, with my nonprofit for working with a yoga studio. They had a Reiki practitioner there, and she had offered, because she wanted to work with our nonprofit, because we wanted to offer Reiki to our cancer patients. And she offered me a session, but she also, did Reiki sessions at the yoga studio. Granted, this was also years ago. It's a lot more popular and more open. People are more open to it now than they were back then. Some spas actually offer it. There's also individual practices of Reiki as well. So you have that. And look into that. Now, here's the difference. Reiki can also be done remotely, depending on the practitioner. There are Reiki, I would say most Reiki practitioners. Then you have like Reiki masters, which is like the highest of training you can go. The difference is a Reiki master can actually teach other practitioners, help people become Reiki practitioners. Yeah, it can also be done remotely. So, you can even sit at home and have it done, depending on the practitioner. So that's an option. Also, you can do it yourself. Interesting enough, I always tell people. So if you take your two hands like this and you put them together, and then you just kind of sit there and just kind of focus on, think about energy. You can actually feel the energy going between your two hands. It makes sure you can, you feel like a little bit of a numbness, and then you can kind of feel it almost feels like a little ball to some degree going from hand to hand. So that's energy. So you can take that, turn that, and do that to yourself. There is actually a YouTube video. There's many YouTube videos that shows you how to do that with yourself. I've put a link in the description. It's one through Aurora Health. What is it? The Advocate Health Reiki for Self-Care. Or it's through Advocate Health Reiki for Self-Care. That link is actually in the description if it's something you do want to try, and talks about it. You can also, if you don't like it, there's other ones. There may be another one that you prefer. Look it up. Definitely, check it out. If that's something you want to try. Again, that's up to you. But I will say it is something I would look into, especially after finding that information out about studies where it's shown that it's helped, especially help high risk professionals such as yourself with chronic stress. Okay. So definitely, if you do it, leave in the comments. If it's something you want to check out, have any questions, I will try to find an answer for you. Don't hesitate to reach out, ask questions, leave any comments. I know it may sound a little out there for a lot of you guys, but it's worth a shot. If it, helps, it helps. If you're doing it, keep doing it. If you're doing it already. All right. So with that, definitely take care of yourself. Thank you for watching. Remember, if you need to talk to someone, you have Lifeboat through NOMV, Not One More Vet. You can, when you first sign up, it's 72 hours. After that, I think it's within 24 hours. It's peer-to-peer to have someone talk to. You also have 988 that you can call or text. You also have 741 that you can text home to. So yes, you have those. If you need someone, please reach out. Save these things in your phone under a way that that if you need them, you have them. Because, I feel like if you're in that type of state of mind, you just really do not think about like those things. So have them, mark them, whatever would be a good way for you to reach out to reach out. All right. And again, I'll leave you with this poem. So, which was inspired by an old poem. You may not know the world needs you, but it does. For no one else can smile your smile, say your piece, shine your light. You are unique, and you alone can fill your place. If you were not here to shine your light, what would happen to the pilgrims passing by your empty place in the darkness, without your light to help them on their way? You may not know that the world needs you, but it does. Remember, what you do matters, and the world is a better place with you in it. Until next week, take care.